Trauma affects more people than we realize. It's not just about surviving a major disaster. Trauma includes experiences like abuse, neglect, violence, and systemic oppression. These experiences are sadly common. Research tells us that a staggering percentage of the population has experienced at least one traumatic event in their lifetime. These experiences leave lasting marks. Trauma changes how people interact with the world. It impacts their physical and mental health. As EMS professionals, we often encounter people on the worst days of their lives. Many of these individuals carry the weight of past trauma. This understanding is crucial. When we recognize the prevalence of trauma, we're better equipped to provide compassionate and effective care. It's time to change the narrative and approach trauma with the sensitivity it deserves. Our patients, our communities, and our own well-being depend on it. Trauma manifests in various ways. It's not always obvious. Someone might not have visible injuries, but their behavior can tell a different story. They might seem agitated, withdrawn, or distrustful. They might struggle to articulate their needs or relive the traumatic event through flashbacks. Consider a scenario where a patient becomes extremely agitated during a routine medical procedure. On the surface, their reaction might seem excessive. However, this could be a trauma response triggered by a past experience of medical trauma. These responses are not intentional attempts to make our jobs difficult. They are survival mechanisms, ways of coping with overwhelming fear and stress. As EMS professionals, we need to recognize these signs as potential indicators of trauma. Trauma-informed care, or TIC, is a powerful approach that acknowledges the widespread impact of trauma. It emphasizes safety, trustworthiness, choice, collaboration, and empowerment. It's about shifting our mindset from doing to doing with. This means we involve patients in their care every step of the way. We explain procedures in clear, simple language. We respect their boundaries and give them choices whenever possible. We listen with empathy and validate their feelings, even when we don't fully understand their experiences. By prioritizing these principles, we create a safe space for patients to feel heard and understood. This approach not only enhances their immediate well-being, but also contributes to better long-term health outcomes. In the field, there are practical steps we can take to implement TIC. Start by asking yourself, what might this person have experienced that could be influencing their behavior right now? This simple question can shift your perspective and guide your interactions. Use calm, non-threatening body language. Explain procedures clearly, and obtain consent before touching a patient. Offer choices whenever possible, even if it's as simple as asking, which arm would you prefer me to take your blood pressure on? Remember that self-care is not selfish, it's essential. Processing traumatic experiences is crucial for both our well-being and our ability to provide compassionate care. Engage in regular debriefings with colleagues, seek professional support, and prioritize activities that nourish your mind, body, and spirit.